Mental illness means when a person experiences significant changes in mood, thinking, or behavior, and these changes are not caused by a single direct disease. Around half of the population will experience a mental disorder in their lifetime. The most common mental illness is anxiety. A person feels excessive worry, fear, or nervousness. For example, being constantly anxious about their job performance. This nervousness can be constant or episodic, with intense attacks of fear, which are called panic attacks. Even physical symptoms can occur, such as increased heart rate, sweating, and trembling. The main cause of anxiety is stressful or traumatic life events, but genetic factors also play a role. Depression is the second most common mood disorder. A person has a persistent feeling of sadness or loss of interest in activities once enjoyed. For example, an individual who has lost interest in hobbies they once enjoyed and has difficulty getting out of bed. Some people will gain weight while others will lose weight during depression, but it commonly affects appetite. Some people also think about their death and having suicidal thoughts. Depression is strongly genetic, but childhood traumas and stressful events also play an important role. The third is bipolar disorder. It involves drastic changes in episodes of emotional highs and lows, alternating between mania and depression. During mania, a person has inflated self-esteem or grandiosity, decreased need for sleep, and more goal-oriented activities. During the depression phase, a person experiences a depressed mood, loss of interest in activities, and an excessive sense of worthlessness and guilt. The genetic component is the strongest in the case of bipolar disorder, but the stressful life events and substance abuse, including alcohol abuse, also play a role. And the fourth is PTSD or post-traumatic stress disorder. It develops after serious stressful events such as wars, serious accidents, or terrorist attacks. A person experiences flashbacks and unwanted distressing memories of the traumatic events. They may have physical reactions to reminders of the trauma. A person has negative thoughts about themselves or the world and a sense of hopelessness and may detach from friends and family. They may be easily startled or get angry easily. And fifth, obsessive-compulsive disorder. A person has unwanted thoughts and repetitive behaviors. These unwanted thoughts are called obsessions, and the repetitive behaviors are called compulsions. For example, a person may experience an excessive fear of germs, obsession, and engage in compensatory constant hand washing, compulsions. Perfectionism is also a form of OCD. A person has an intense need for things to be perfect and performs complex rituals involving detailed and the time-consuming tasks to compensate this obsession. And 6, somatic symptom disorder. It occurs when a person experiences physical symptoms such as pain that cannot be explained by their current medical condition. Previously, this was called somatization. It affects 16% of world population. A classical example of somatization is recurrent and unexplained nausea, abdominal pain, and diarrhea. Somatic symptom disorder is commonly associated with stress and anxiety, and psychological factors play an important role. Such individuals commonly exhibit health-seeking behavior, including frequent doctor visits and excessive medical tests. And 7th, eating disorders are also very common. A person is preoccupied with their appearance, body shape, and food. If they eat large amount of meals in short period of time, it is called bulimia nervosa. If they minimize food intake, called anorexia nervosa. People with bulimia usually cope stress with eating. Cycles of binge eating are often followed by compensatory behaviors such as vomiting, excessive exercise, or use of laxatives to prevent weight gain. Individuals with bulimia nervosa typically maintain a normal weight, making the disorder less noticeable. To treat all the aforementioned disorders, the first-line treatment is usually cognitive behavioral therapy, or CBT, which is a form of psychotherapy. The idea of CBT is that our thoughts, emotions, and behaviors are interconnected, and changing one can lead to change in the others. If we identify negative thoughts and replace them with healthy thoughts, how we feel will change. Another common treatment is use of antidepressants. The most commonly used ones are fluoxetine, sertraline, and escitalopram. These medications increase the level of serotonin by inhibiting its reuptake. Generally, they improve mood, reduce anxiety, and increase overall well-being, but they have negative effects also, such as sexual dysfunction, weight gain, fatigue, and an initial increase in anxiety symptoms. Rarely, they may decrease motivation and cause emotional blunting in some individuals. They can also cause withdrawal symptoms if stopped abruptly, characterized by dizziness, irritability, and flu-like symptoms. From supplements, omega-3 fatty acids, vitamin D, and magnesium have an important influence on well-being and mental health. For example, omega-3 fatty acids and magnesium can reduce anxiety, while a deficiency of vitamin D causes anxiety, and St. John's wort is known for its antidepressant effect, and zinc intake can also improve the action of antidepressants.